In your health news now, did you know that 62% of Americans skipped or even adjusted the dosage of insulin injections just to cut down on costs?
Yeah, this is according to a study commissioned by CharityRx, explaining the financial burdens of U.S. insulin pricing on diabetics and their caretakers. And this was across the country.
While the Inflation Reduction Act did cap the cost for Medicare recipients at $35, thousands of other type 1 and type 2 diabetics still must pay very high prices if they don't have adequate insurance coverage, including here in Ohio.
Senior health correspondent Monica Robbins explains why the prices went up and what you can do about it.
No one should have to choose between groceries and living.
But that's the reality for millions of American diabetics. Rachel White is type 1 and her life depends on insulin injections.
It breaks my heart just thinking that this life-saving drug isn't necessarily available or affordable to everybody.
The Inflation Reduction Act helped the 1 in 3 Medicare recipients who rely on insulin by capping the cost at $35. The law takes effect in January. But for those under 65 who may be uninsured or underinsured, the cost of insulin is astronomical. A Yale study found about 14% of Americans who use insulin reach catastrophic spending on insulin costs, meaning 40% of their income paid for insulin. Rachel's sister, Rebecca, understands the impact. Her husband and daughter are diabetic.
We added my daughter's costs on top of my husband's. It just became really astronomically expensive.
Monthly cost used to be under $200. Today?
Now his monthly supplies, retail would be $900 if we had to actually go out and buy it.
Rebecca lives in one of 22 states that capped insulin costs, which brought her relief. Insulin capping bills were introduced in Ohio, but so far none have passed. So why are the costs so high? One reason is evergreening, where manufacturers slightly change the formulation so they can extend patents. Another reason is demand for the latest formulation and middlemen drive up cost. And the lack of generic versions is also a reason for the price hike. Newer versions of insulin can easily retail for more than $300 a vial. Diabetics typically use 1 or 2 vials a month. Studies suggest as many as 1 in 4 turn to rationing.
There are stories where people have to stretch their insulin supply until their next paycheck, and that is so dangerous.
What can you do? Check out manufacturer websites. Some offer copay caps, coupons, or discount cards that may help. Go to getinsulin.org, where you plug in your information and they find the deals you may qualify for. Talk to your doctor or pharmacist about other options. Price shop local pharmacies. And contact your state and federal representatives and ask them to support price caps.
Monica, thank you for this information. This is interesting, and I'm sure it affects, a number of people. Is there any help on the way for this?
It's going to be a while. We just went through this, but there is a low-cost insulin by a nonprofit drug maker set to enter the market in 2024. And Maine, California, and Michigan are actually exploring how they may work with manufacturers to produce their own versions of insulin to sell at cost for everyone.
Oh, yeah, wow. Those prices you mentioned are insane, to say the least. What should insulin cost?
Well, let me give you a little history. So
Okay.
scientists discovered the link between diabetes and damaged cells that produce insulin in the pancreas back in the 1800s. In the early 20s, researchers in Toronto extracted insulin from cattle pancreases and discovered it helped diabetics. So they sold their patent to the University of Toronto for a whopping $1 each, saying insulin belonged to the world. The animal type, of course, did not work for everyone. Science advanced, making higher quality and safer insulin. And the older animal-based insulin that may have been a much cheaper alternative, shocker, disappeared from the market.
Imagine that.